Dr. Matt Rossheim, thanks so much for joining me on the show today.
You're welcome. Thank you very much for having me.
Oh, absolutely, of course. I was actually, I feel remiss that we haven't either done an episode by now or haven't had a conversation. I just reached out to you a couple months ago. I cite your work so often in my presentations because I'm oftentimes speaking to audiences of preventionists or youth or parents, and you are just very present right now in the best possible way in this space around how do we inform the public about topics related to vaping and then THC and what I've been calling semi-synthetics, although I think you might have a different term for that. You're very active in that space. And what I wanted to do, though, to get us started was just to ask a little bit about what brought you there, because I feel like when I look back at your research portfolio, we've seen kind of like a funnel effect where this has become your area of focus over time. Could you talk to us a little bit about what brought you here?
Absolutely. Thank you so much. I appreciate you saying that. It's been a lot of work, not only from me, but also a lot of teams of researchers, advocates, and folks at our health science center here who've been helping disseminate that information. So glad to hear that it's been very fruitful. So I actually have kind of an interesting start into public health. I was studying economics at the University of Florida as an undergraduate student, and just really interested in like behavioral economics. So kind of the psychology side of it beyond financial incentives, what motivated behaviors. And so I didn't know what I wanted to do after I graduated. It was my senior year, and I ran into an old high school wrestling buddy, and he was doing his master's thesis on the price of alcohol at the bar districts in Gainesville, and how heavily intoxicated people were when they were leaving the bars. And so I thought this was just interesting to volunteer. We recruited people leaving the bars and gave them a slice of pizza for participating in the study, and they were happy to participate for a slice of pizza. And as we would expect, lower cost of alcohol was associated with higher intoxication levels as they were leaving the bars. And so I just thought it was fun. I didn't think much of it. But our next study that we looked at using these data, we asked them about what all they drank that night to calculate how much alcohol they'd consumed. And so we analyzed alcohol mixed with energy drinks, because this is when the Jaeger bombs and Four Loko and things like that were Red Bull and vodka and stuff like that were getting popular among college students. And we found that bar patrons who consumed alcohol mixed with energy drink had 3 times the odds of exiting the bar legally intoxicated for driving purposes, so having a blood alcohol concentration above zero point zero 0.08, and were 4 times as likely to intend to drive to their next location. So we hypothesized it was kind of mixing uppers with downers, right? Alcohol, a depressant, with caffeine, a stimulant, a lot of caffeine. And so they were continuing to drink more and intending to drive to their next location. And so what really got me interested in public health research was that agencies, the Food and Drug Administration, sent letters to the manufacturers of these prepackaged caffeinated alcoholic beverages like Four Loko, stating that caffeine is an unsafe additive to their products. So seeing the actual impact of that research and that it could support regulations. And so I've spent, that was back in 2008, 2009 that we were doing that research. So the last
Wait,
15
hold on.
years.
So you were the guy who killed Four Loko? That was you?
So my
That's
research
fantastic.
helped support it. There were a lot of advocates who did a lot more boots on the ground work, but it was cool just as an undergraduate student getting to see that research study that I was involved with, getting cited by these agencies. Um,
I think that's fantastic. My
yeah,
hat tip
so
to
I,
you.
I can't take all the blame or credit, but just to have played a small role in that got me excited and got me to continue to pursue this line of research. And to your question of how I made the transition, I've always had an interest in the marketing, especially when we think about marketing from the 4Ps perspective: products, prices, promotion, and placement, because those are major determinants of substance use, whether it's alcohol, tobacco, or cannabis, especially among young people. And so the reason that I started focusing on these products is it really seemed like the Wild West in terms of marketing of substances that was youth oriented, high risk products. And there wasn't a lot of research being done in this area. So I saw this as an important opportunity to conduct some important research studies in this topic area to inform public health advocacy and related regulations.
I'll be interested to hear about if you've had either what you would consider successes thus far in that area, and we'll probably swing back around there at the end. Although because I want to dive into the basics first, but it really is very much the Wild West. I feel like I've seen that in many news articles, and based on my own anecdotal experience, it's true. I think, well, actually, I will ask you a quick follow up then around that idea. One of the aspects of this that I find fascinating, but also a bit disheartening, is I feel like a lot of times when you don't have guardrails, when it is the Wild West, things devolve into that sort of Wild West situation where people are taking what they can get. I mean, that's where the phrase comes from, right? Bandits were running around. There wasn't consistent law enforcement. They were taking whatever they could. And I feel like it's not like what we see when this is the case, that people just, they've got this really, like, companies have this very strong sense of ethics, and ethics are guiding their mission to make sure that they are only acting in ways that clearly are linked to the betterment of the public good, as opposed to making money while they can. Is that similar to your experience as well, when you look at when there's a lack of guardrails, that people go over the side very often? Or does it seem like what we've been seeing recently in those industries, as you were mentioning, is more the exception to the rule?
Oh, absolutely. So it's the norm that these products are very youth oriented. We see that they are brightly colored, fruit flavored candies, chocolates, chips that are labeled with cartoon characters and have high THC potent products, and sold for low prices and disproportionately low income communities. All of the bad things that we saw from the days of alcohol and tobacco and all these other substances. That's really why it is the Wild West. It's very youth-oriented products and very dangerous substances that they're selling. If they were responsible companies, they do some research about the effects on human health of these products before just them selling them widely on the market.
Yeah, yeah. I almost feel like there's a very you can call it a libertarian approach. If people have the right to put whatever in their bodies that they want to, and we're going to offer it. If people choose to put it in, to use it, they're taking that risk. I know that, I can understand that that is a perspective. I know that coming from a healthcare perspective is very concerning, right? That particularly if there are certain narratives about, there's narratives around cannabinoids being more health focused. There's been a strong push towards marketing it almost as like a health product. And while we can, certainly go down that rabbit hole if we want to, a lot of these new products, they haven't been studied, both in terms of any potential benefits and certainly in terms of any potential risks.
Exactly. Yeah. So the argument that, as long as people are informed, nobody's informed about all of the health risks. We know that it's harmful. We just won't know the extent of this harm for many years. And a lot of the practices from these companies, they seem to be very bad actors in terms of not even appropriately labeling their products so that people can be informed, having it, be trademark
Yeah.
infringed products that look almost identical to, kids' favorite snack brands, candy brands. So yeah, we are seeing
Yeah.
a lot of bad actors in this area now.
Yeah. Well, we'll swing back to that, but I do want to start with one of these foundational questions of what do we call these products, which, not coincidentally, or whatever the right word would be, was the name of one of your papers about a year ago, where there's been, it's hard to know what to call them, because just say like the name cannabis is so broad in so many ways, and what we're seeing right now is very different. So maybe we could take a second for listeners who aren't as aware. What are these new products that people might be finding in gas stations or online? Where do they come from? And where does this confusion exist around naming and what to even call them?
Yeah, that's a great question. This is something that our team struggled with in the early days of like, what do we even call all these products? How do we distinguish them from, regular cannabis, from CBD, from, the fully synthetic products like K2 and spice that don't exist in nature, that are just chemically created, not THC. So like, what's an umbrella term we can use for these products? So we published that paper. I was inspired by a paper that was published in Tobacco Control that, all the different terminology that was used for e-cigarettes or vapes or electronic nicotine delivery systems. They were weighing the pros and cons of different terminology used and trying to kind of narrow it down so that there was some consensus in the scientific literature of what terminology to use. And so we took a similar approach. We looked at all of the different terminology that was being used for these. We kind of broke it down into the what they were trying to distinguish, whether it was the product themselves, the manufacturing, and have it specific enough to include all the products, but not including other, substances. And so we really were trying to balance accuracy and understandability of the terminology. And so what I say to advocates who are using these terminology is it depends on the terminology that's already being used by legislators in terms of what words to use if they're calling them semi-synthetic cannabinoids. It also depends on state laws. If you're advocating for state laws, using the word intoxicating or impairing might interact with other laws. But I think as long as you have an understanding of what those products are, what we tend to refer to them now as are as derived intoxicating cannabis products. Derived meaning that these aren't naturally grown cannabis products; they're chemically created. Intoxicating
Mm-hmm.
in that they have some sort of impairing effect or psychoactive effect beyond that of like CBD, right? It can get you high. And then cannabis products is pretty self-explanatory. It comes from the cannabis plant and has similar effects to THC.
Mm-hmm. Yeah, I think that's a good label. I'll try to work that into my normal lexicon. I've been using semi-synthetics for a while, but I think that that does cover a broader range and probably one that's actually more accurate in general. But I hear you, right? Speaking the language of the community is the most important to getting a message across, and sometimes coining a new term, even a more accurate one, you run into some roadblocks. Well, so again, for folks who aren't as aware, so what is the different route that these products take so that they end up in a gas station versus a dispensary, or in states that say have recreational or medical programs?
Yeah, that's a great question. So this really all started with the 2018 Farm Bill. So what the 2018 Farm Bill was intending to do was to legalize hemp for industrial purposes. Advocates for it were saying that it's rope, not dope, and so it was used to make rope and pants and all sorts of material goods, not meant to be ingested. However, based on how they designed the law, retailers have been selling these products, intoxicating products, and as if it were hemp. And so how this happened was they defined hemp in the Farm Bill as anything to do with the cannabis plant that has less than 0.3% Delta-9 THC by weight. And Delta-9 THC is the most naturally abundant intoxicant in the cannabis plant. And so that's why they defined it this way. They wanted it to be very little, no intoxicating effect, really, that it was just these products that were sold for, making material goods. And so retailers have exploited this in a number of ways. For one, now they've been selling edibles and beverages, THC beverages. You can see those and THC
Yeah.
gummies in states that, vape shops and gas stations in states that don't have legalized non-medical cannabis, because what they're doing is they're artificially inflating the denominator. They're infusing what would be illegally high potency or high doses of THC, but they're mixing it into gummy bears or adding it to beverages and using the weight of the food and beverage as the denominator, saying that this THC laced beverage is actually hemp,
Mm,
according to the federal definition of hemp. So they're exploiting it in that way. The other
yeah.
thing that happened is there's a bunch of other types of THC that act similarly, and some are more potent versions of regular Delta 9 THC, but they are naturally occurring in very low quantities, so low that it's not economically viable to extract them from the plant and sell them. And so, what people figured out how to do is how to chemically create these different types of THC. And so, what they're doing is kind of a simplified version of it is they're extracting CBD from the cannabis plant and they're using acetic acid or other harsh chemical catalysts to create different types of THC as some of the chemical byproducts. And then they're spraying it on hemp flower and selling it for people to smoke, or they're infusing it in gummy bears or putting it in vape liquid and having people vape it. And this is a major problem because a lot of these, we've identified dozens of different types of these that are being marketed, and the vast majority of them, there's almost no studies on the effects on human health from use in
Hmm.
general, let alone in all the different modalities and combinations that they're being sold.
Yeah, I think in one of your recent papers you said that there are 26 different hold on, I got to get it right. It was mostly semi-synthetics, derived intoxicating cannabis products that you found that were being sold. And I think one of the key facets here that my hunch is a lot of particularly younger folks don't understand is that these are different chemicals, and that means that there are different potential implications on health. If we leave the intoxicating element or what the experience of that is aside, in terms of the risk, because again, I feel like there's been this very carefully curated and cultivated reputation that cannabis has as being a softer drug, say, that when you start chemically changing it into something else, it's not what it used to be. Is that accurate?
Yeah, so the substance that's been studied the most is Delta-8 THC, and from the studies that have been done on that, it causes a lot of the same health effects as Delta-9 THC, as regular cannabis, in terms of serious mental health problems, addiction, cognitive impairment, respiratory problems, cardiovascular, heart health issues. You know, Regular cannabis use is associated with adverse pregnancy outcomes. So we see a lot of the same uh, things, but also just from how it's chemically created, there can be chemical byproducts, heavy metals and things that the Food and Drug Administration and Federal Trade Commission have issued, warnings about these products, that they can be, contaminated with other substances. But even if there is adequate testing and, they aren't contaminated, the substances themselves are dangerous for use. And
Mm-hmm.
so uh, there are major issues with regard to how these products are being marketed, and it's very concerning how widely available they are. Considering, like you said, a lot of these chemicals, like HHC, it's been studied some, but THCO, THCP, THCJD, a lot of these substances being marketed, there's almost no studies on the human health effects of them. And yeah, a lot of them even animal models, because they've just been very recently used. So
Yeah.
it's very concerning. And the
Oh,
26 ones that
absolutely.
we identified, that was just on three leading websites. So there are likely even more of
Mm.
those available.
Right, right. If people are making their own derivatives, it reminds me. So I thought this was so interesting. So for a while, when I was doing a talk about THCO acetate, which is, well, one of the, it's actually, I'll say, rumored to be more potent because we don't have studies on that. But anecdotally, people were saying it might have been as much as 3 times as potent as Delta-9 THC. Um, I had been pulling a YouTube video from someone who does like a cannabis show, talking about it, where he actually uses it on screen and becomes intoxicated. And I thought it was useful to show the audience rather than just tell. And so I was going back to find it again recently, and I found that it had been deleted. And I was like, that's very interesting. And so I poked around, and actually, to this gentleman's credit, he had actually posted a new video saying, "Hey, I just read an article, that article that came out about how THCO creates ketene. And ketene is what was responsible for the EA Valley outbreak. It's also produced from the thermal degradation or pyrolysis of vitamin E acetate, which was what was causing a lot of that, that initial outbreak of E Valley back in late 2019, early 2020. And he saw this article and said, so this sounds legit dangerous. So I'm sorry that I promoted this. I've deleted all my old videos, and I probably encourage you guys not to do it too, because this potentially has health risks. And I thought what was interesting about that, one, I was glad to see that that was his action upon learning that information, but that it really is the sort of situation where one, you put something like that out there in the ecosystem before it's studied, before we've actually tested it for safety, that anything can happen. And it seems like then all of a sudden we're playing catch up, or we have to be reactive. Where people are like, oh, wait a second, maybe we shouldn't do that because it's potentially coating our lungs in oil, but it's already been running around for what, like a year, two, three by that time?
Yeah, and they're still
I
still
don't know.
widely
Yeah.
available, even though the DEA clarified that it's a Schedule One substance now, THCO. Uh, yeah, and when that happened, some retailers were still selling it, and I asked them when I went into the stores, "Hey, isn't that federally illegal now?" And they were like, "Oh yeah, they're on sale because of that. They're BOGO, because they're illegal now." So
What? Oh man. Because that's what you do when something's illegal to sell. You make it less expensive just to get it out of the store, get it out of
right.
here a little bit faster. Well, what would you say then in terms of what you're seeing in your research? What are the most common semi-synthetics, and are there particular, like, really quick hits? Because I've seen it as well. When you look at the websites that sell them, there's just dozens. It's like an alphabet soup of different, hyphens after THC or HHC or whatnot. Are there ones in particular that we should have on our minds, and any that you have seen from the research thus far that seem more risky than others?
Yeah, great question. So in terms of riskiness, there's not a lot of information about when there are outbreaks with things like THC JD or things like that. It becomes the public becomes aware of it, but for a lot of these, people don't even realize what they're putting in their body. From an epidemiological perspective, it's so hard to study. I called hundreds of retailers selling these products to ask about what all they're selling. One of the best quotes from one of them was, they said, you got to come in here. I basically sell the whole darn alphabet. And most of these stores sell more blends than stuff individually. So most of their product doesn't just have one of these intoxicating cannabinoids in it. It has 2 to 8 different ones in a single product. And there's no
Yeah.
information about like how much of each of them. There's thousands of different brands and different products and modalities. And so, they're not
Can
well
I hop in
labeled.
for a second, actually?
Yeah.
Quick question about that, and then I promise I'll let you finish your response. Wouldn't that, what's the reasoning behind that? If you don't necessarily know what any of them do, why are you just like creating a soup of different compounds rather than just sell them more pure? Is it just like, let's just put a bunch of stuff in there and hopefully something works? Or do you have any idea why that's how they're made with all the combinations?
Yeah, that's a great question. It may be because there's just a bunch of different chemical byproducts from how they're making deriving the THC. Some of it appears to be intentional, though. Like THCP, for example, it's marketed as hitting you faster but having a more short-lived effect. So it's the most common one that they're putting in these blends because they want it to hit you fast, and then the other ones will keep you high. So that seems to be why THCP is marketed. Um, but some other really interesting things about kind of the marketing of these products and the types of substances available. I did a couple of different studies where I called vape shops. One was, I was telling you about it in Fort Worth, Texas. I called over 100 vape shops. Um, the culture has really changed a lot in terms of use. I mean, I called them around 420 to ask if they had any price discounts for 420, because again, price is, and along with access, is one of the major determinants of use. And I was surprised that a lot of them were actually hosting events where they had, DJs and food trucks, and they were handing out free edibles and letting you take hits of the bongs in the store to test out the glass before using it. And, they're poke and smoke shops, a tattoo parlor that, will not only give you a discount on weed on 420, but they'll, give you a discount on a tattoo with a 420 design on it. So the culture is definitely changed, considering that we're only a medical cannabis state and only like 1% THC in our medical program right now, with these loopholes. But
Mm.
what was really surprising to me was when I made these calls nationwide, I was shocked by how retailers are basically acting as if we are a recreational cannabis country. So I called 10 vape shops in each state, Washington, D.C., and Puerto Rico. And between that and where there are licensed dispensaries, without a medical card, you can walk into a retail store in every single state and purchase cannabis products that will get you high. In a couple of states, it appears to be just limited to dispensaries. But in all of the other states, it includes vape shops. And the main ones being sold appear to be Delta-8 THC, the Delta-9 edibles, HHC, and in some states, THCA. The ones that are most popular in each state seem to vary based on how they can work around state laws. So in some states, if they've banned all the synthetic ones, it'll be the Delta-9 edibles. Or if they've cracked down on, THC potency limits, then it's HHC. Or if it's any intoxicating cannabinoid, then it's THCA because it's a chemical precursor. It's not intoxicating until you heat it, including like baking
Mhm.
it into things. And so um, it seems like it's regulatory whack-a-mole. When states try to put regulations on this, they come up with a chemical solution to still be able to sell intoxicating cannabinoids. But what we
Yeah.
did find worked in that study was state bans. State bans were strongly associated with reduced retail availability of these products in vape shops.
Hmm. Yeah. How much of a reduced availability was there with the ban?
Yeah, once we adjusted for other confounders, including state laws on non-medical cannabis and active retail of that. In states that did not have bans, vape shops had 16 times the odds of selling any intoxicating cannabis products compared to states that did have bans. And so that is a from a public health perspective in terms of access, that's a major reduction in the availability, and was very highly statistically significant. However, 43% of vape shops in states that did have bans still sold some type of intoxicating cannabis product, meaning that they were still circumventing it in some way, or it wasn't well enforced. So these type of laws need to be comprehensive to include all of these products and well enforced in order to be effective. But to put it in perspective, states that had tried to regulate the availability of these products, either through reducing their retail availability or through potency limits, like putting a cap on the THC limit by weight or per serving. Um, those states, it was not associated with the reduced availability, even though that was the intent of their law, was to reduce availability, because they're coming up with these different chemicals to circumvent their laws. And so in across the U.S. in states without bans, or I'm sorry, in states with limited or no regulations, 92% of vape shops sold intoxicating cannabis products. And
Yeah.
in comparison, those with those regulations designed to limit availability, 90% of vape shops sold intoxicating cannabis products in those states. So only a 2 percentage point difference, which was not even close to statistically significant.
Yeah, or practically, in terms of
Right.
someone walking in. Well, so here's a question then. And I did read your paper on how prevalent and accessible these were, and it mapped on to another paper I'd read about how 92% of online vendors, that might have been one of yours as well, actually, will ship to you in a state where even if there's a ban there. What do you make of that then? Like, wouldn't it be possible theoretically for, say, a police officer to just walk in and give a citation, have a store not do that anymore? And if that's the case, do you have any speculation, hypothesis as to why this just is running roughshod over, even if we just take the states where there are bans? If 1 out of 2 vape shops is doing it, it seems like they're not scared. They think they can do it, and they're right.
Yeah, absolutely. Yeah. So this goes down to the bans need to be comprehensive and well enforced. And so um,
Yeah.
that's why I'm advocating for bans of these products. It seems to be what's working. When they try to regulate, the industry has constantly showed again and again that they will work to circumvent any and all regulations. I mean, that's really what these products do on the marketplace. That's their primary function, is to circumvent cannabis laws,
Sure.
basically, right? And in doing
Hmm.
so, they're introducing products that are likely even more harmful and are very much more aggressively marketed to young people, very blatantly. With all the things that we know attract young people, they're
Yeah.
including the modalities of these products. And so um, that's really why these comprehensive bans and strong enforcement is needed. And with regard to specific actions, it just depends on the state, what their state law is. They might need to just
Yeah.
increase enforcement of existing laws. They might need stronger state laws to be more comprehensive, or to give teeth in some of these regulations. We've learned from the alcohol and cannabis world, and tobacco world, that we shouldn't be punishing the kids for purchasing these products, right? It shouldn't be the consumers. They're called PUP laws, purchase, use, possession. Not only are they ineffective at keeping it out of the hands of young people and consumers of all ages, but it also is very unjust, right? We shouldn't be involving children in the criminal justice system for buying things that
Mhm.
are sold right on their street corner, including in a lot of
Right.
states. Most states don't have any age limits on this. In a lot of states, there's nothing stopping retailers from selling these products directly to children. And I've spoken to some high school students who said, it's kids selling it to other kids. They have high school students working at the corner store right across from the high school, and they're high school students working at it, and they're selling these products to other high school students. So it's a huge issue,
Yeah.
especially
Oh
for
yeah.
kids. But for anyone in general, it's a harm. These are harmful substances that are now widely available.
Yeah. Well, and I have somewhat of a specific question that you may not know the answer to, but I want to put it out there because I read an article last week that they were diving into the new NISDA data that was just released, and they were finding that based on the national data that's reporting on substance use disorders, that 30% now of self-reported past year cannabis users are endorsing symptoms that meet criteria for a cannabis use disorder. 30%. And that number is up from, if you flash back about a couple decades, that's up from about like 9% for adults. This was for adults. So that number used to be at 9% for adults, I believe 16% for youth, and then 25 to 50% for daily users, which also is a lot higher today than it has been ever in the past. I think right now, current cannabis users, about 40% in a recent study say that they use it every day. And what I'm wondering from an addiction psychology perspective is that's my background. Do we have any data on the habit forming potential of any of these semi-synthetics, or I'm sorry, psychoactive derived intoxicating cannabis products? I'm going to get there. I'm going to get there. I feel like this is me. This is analogous to using person first language, like where you switch to it has alcoholism, right? This is my own version of that now. But do you have any data on that specifically?
Those are longer term outcomes. A lot of that isn't available anecdotally. There's a lot of kids who use it, and with especially these high potency products, they feel addicted after the first time using it because they're such high potency products. We know that, especially for young people and especially for high THC doses. A lot of these chemicals are very chemically similar to regular Delta-9 THC. So theoretically, there's strong biological plausibility that yes, they are addictive as well. But again, there's just so many of these substances being used in so many different combinations. It's going to take decades to disentangle this. But from
Right.
the acute effects of people being like illustrating signs of addiction, withdrawal symptoms, things like that, cravings, along with the acute mental health disorders, psychosis, things like that, provide some strong anecdotal evidence that they do. I think what's really important with what you mentioned is when it comes to rescheduling. When there's discussion of rescheduling cannabis, one of the main criteria has to do with the potential for addiction and abuse, and so with that in mind, and how strong the evidence is now for cannabis in general, it seems that cannabis does, from a scientific perspective, meet Schedule 1 criteria. Now, from like a
Yeah.
political perspective, and whether we should be criminalizing it and things like that, that's a different. But in terms of just the science of how addictive it is, it does meet criteria as a Schedule 1 substance. So
Yeah. Yeah, no, for sure. And we could certainly talk a lot more about that. That's another big rabbit hole. I guess just my quick thought on that, of which I have many, is that what you're pointing out about how if we're trying to reschedule cannabis, that is a huge umbrella term, particularly now, even more so now than it was even 20 years ago. And to say that, that say like a 5% THC cannabis flower that one would say smoke, which has its own risks, but smoke has the equal therapeutic value or harm adverse event likelihood as any of the things we're talking about today is ridiculous, much less concentrates, yet that all is under the same umbrella of cannabis right now. What this strikes me as you're talking about it, though, is that particularly with these newer products, these derived ones, that it's really like a roll of the dice where you don't really know what it's going to do to you. Nobody does, and if someone tells you they do, they're lying to you. We just don't have good data on it yet. Something though that also really has stuck out to me about this market, these products, is the lack of consistent labeling. And I'd love to get your opinion on this, but before that, I just wanted to elevate a paper here. It was done in Illinois, where I'm based out of, by Dr. Jennifer Bash. She looked at a bunch of products that were hemp derived that are being sold here in Illinois, and actually found that 92% of them were inaccurately labeled. So 9 out of 10 times, what you think you're getting is not what you're getting, both in terms of how much or how little of what you think you're getting. Like if you think you're buying a Delta-8 product, how much of that's in there, but also in terms of all sorts of these other compounds, like you were mentioning, that are in there that you didn't know you were putting into your body. Does that square with research you've seen in other states or nationally? And And if so, like, what do we make of that from like a health perspective?
Yes, that is consistent with other lab studies that I've seen. That the THC content and the types of THC. That there's other types of THC that aren't reported, and that the THC levels are grossly underreported. Um, yes, that is consistent. I think it just really shows how these companies, they want to have the guise of social responsibility of, oh, we're labeling our products and we're taking all of these voluntary steps to inform consumers and things like that. But they're not really. They want that appearance of being responsible, but they don't want to be responsible when they don't want to be financially responsible or legally responsible when bad things happen. They want to take credit for the anecdotes
Yeah.
of how helpful it is to people's lives, but they don't want to. They don't actually want to be held responsible. And I
I
think
want to
this.
share
Go ahead.
a quick anecdote about that actually here in Illinois. So we do not have any real regulation on these products here in Illinois. And what I find just completely supports what you're saying is that actually the hemp industry here, the ones who are creating it have, they've gone on news shows and said, we're okay being regulated. We don't want this getting into the hands of anyone under 21. We're all for it. But then year after year, these bills go nowhere, despite the fact that preventionists would very much like this. The cannabis industry, actually, like the marijuana industry, dispensaries hate these folks because they have to jump through all of these regulations and fees and licenses. Whereas, these products are just being sold out of gas stations. Yet every year, nothing passes. And it's just, again, one of these really interesting moments where it's like, okay, seems like you're talking out of one side of your mouth here because you say you want something, but then when the rubber meets the road, nothing happens.
Yeah, I think that's a great segue into what's happening at the federal level right now. So there was a amendment introduced to the federal farm bill, the Mary Miller Amendment, that would explicitly make illegal these semi-synthetic cannabinoids or derived intoxicating cannabis products. And
Mm-hmm.
so the industry has been using a variety of tactics to push back against this. One is the traditional sky is falling tactic of, this is going to make all hemp, all CBD, everything illegal. We can't possibly, which that's not at all the intent of this law. It's just to ban the intoxicating, cannabinoids. And the other tactic that they're using now is pushing hard for self-regulation. That the hemp industry, is the most knowledgeable industry, and so we know most about this, and we should be regulating ourselves, which is really, the fox guarding the hen house, and is very
Oh,
deceptive. Even how it's worded, how they want to, promote. It's the adult use program for we want to promote safe products and things like that, but all of these products are dangerous and harmful, and so just even how it's all crafted is very deceptively worded. And the self regulations that they're suggesting are would do nothing to about all the public health concerns and things like that. It's very minimal regulations that if they were actually responsible industries, they would already not be selling it to kids and things like that. But it's harmful to everyone.
yeah.
And if they want to be responsible, then they should do studies demonstrating that these products are safe before widely selling them nationwide.
Yeah, I know. It's so interesting. I don't know how you could suggest that someone regulates themselves with a straight face. I mean, I think that's literally like the definition of a conflict of interest.
Right.
And yeah, yeah. But and to that end, in terms of where we might go with self-regulation, I know that you brought actually a couple of products that you wanted to reference and talk about how these are marketed and how they do seem to be marketed more towards youth. Uh, would you mind telling us a little bit about what the marketing looks like, describing it for our listeners and those who are listening? We'll post some links on the show notes if you'd like to come see what Matt's got here today.
Absolutely. Yeah, I'd love to share a few products with you. This one is a chocolate bar with anime characters on it, cartoon characters, Rainbow Rocks flavored, Delta-8 THC with flowers and other images. Here's an
Like
ice.
as like a 55-year-old woman, I think would really look at that and say like, this is for me. Yeah,
Yeah, clearly to an adult
yeah.
demographic. Same thing here with the ice cream cake flavored vape with Delta-8
What?
THCA and THCP.
All right.
Both.
So listeners, are we looking at a marshmallow with eyeballs popping out and melting down its face? Is that what I'm saying? Or is this out a piece of cake?
It could be either. Yeah, it's very cartoon like. It could be either of those. Yeah.
Yeah, yeah, no, it's odd. It's oddly graphic, Yeah. Wow. Okay.
There are ones with teddy bears on it,
Yeah.
and
Slightly disturbed teddy bears. Yeah.
this was the chocolate bar that I got, that a BOGO, because it had THCO in it.
Oh, yeah. For making there they are. Okay. Yeah.
And then this one this is a regular bag of Cheetos Puffs, and this
Yeah.
is like, as you can see at the very
Wow.
bottom here, 600 milligrams of THC,
Holy
but
moly.
clearly trademark infringed.
Yeah. No. It's so again for listeners, we're looking at basically the exact same packaging. Literally, like the entire design's the same, except that one has a tiny little icon at the bottom.
And
Yeah.
600 milligrams of THC. So states that often limit THC per serving, they do like 5 milligrams per serving. So that has 600
Yeah.
milligrams in this little 1 ounce bag.
Well, so can you talk to us a little bit about the reception that this sort of presentation, your research, and then literally when you show them, hey, this is what's actually going on, the sort of reception that you've gotten either from state government, federally, because to me, I look at that and say, wow, this seems pretty blatant. Like this is very clear that this was certainly not the intent of the Farm Bill, much less, that we would want. Like you can clearly see how a young person might look at that bag of Cheetos and not understand that 600 milligrams of THC is a tremendous amount. Last I checked, a joint of today's flower, which is just a lot more potent than it used to be, you might be getting like 35 or 40. Am I correct there? Milligrams of THC from it. So 600 would be a tremendous amount of THC if one was to actually eat the whole bag, and maybe even one edible would be a lot potentially too.
Yeah, I was doing a study on various websites of the recommended dose, and the majority of these edibles that they sell are gummy bears, and oftentimes the recommended dose is like start with like a quarter or a half of a gummy bear, because these products are just so potent. But who is going to read that and actually
Does
only
that?
try like a quarter of one gummy bear, right, and wait 2 hours? Um, so yeah,
Yeah.
when I present to adult audiences, whether it's community members or legislators, they're shocked. But when I present to high school students,
Mhm.
they all know about this. They're like, "Oh yeah, they sell this everywhere. Yeah, kids in my school do. Yeah." So the kids are already aware of this. It's the adults in the room who this is shocking to, and they're hard to, unless they've been studying this issue and doing assessments in their community of how widespread it is and how egregious it is.
Yeah. What it reminds me of a little bit, right? But then sometimes there's still this paralysis, right? Even when someone sees that there's a problem, for them to do it, particularly with politics, there's like all of these different calculations that they have to think about. I remember when we were first talking about recreational marijuana programs here in Illinois, that part of what I was doing was I was going to, I actually went to several, I'd say maybe like 10 state legislators and said, hey, do you know what we're really doing here? And even with the medical market, I would actually pull up the website of a medical dispensary and say, look, these products are named things like BioJesus and Poison and Layer Cake. And, and this is how we're marketing something as medicine. And look at the potency levels. And I need you to understand like what this is. And I can't tell you how many times people say, I voted for, like, that was what I voted for, because they had it in their minds that it was something very different. But even given that, there's been no meaningful reform to medical or recreational cannabis here in the state of Illinois in terms of limiting those sorts of marketing tactics or potency caps or anything like that. It's just so, again, I don't know if this has been your experience. It's just so tough to get movement.
Yeah, but you know what? Legislators are annoyed by this. They feel like they were deceived. They remember a few years ago, folks in the hemp industry saying this is rope, not dope. And now they're seeing this and saying, you know, the industry is pushing back and saying, you're destroying small businesses. And they're saying, well, we never wanted these businesses in the first place. This was never the intent
Right.
of the law, and you guys have been exploiting this. And at the same time, saying that, oh no, now we're going to be responsible actors. Just, let us regulate ourselves. It's crazy.
Mm-hmm. Yeah, it's almost like, and that's what we've heard here too in Illinois. People talk about like a revenue lost and businesses and jobs, and it's like it almost feels like squatters' rights, where it's like, oh, we're here now. So now that we're here, even if you were never actually supposed to be here in the first place, now you can't make us leave. That's definitely seems how it's been going. But well, let me pivot us for a second here because this was a study actually that really stuck out to me that you did recently about intoxicated driving and about how you found that about 1 in 3 young adults, this I think you were looking at 18 to 25-year-olds, said who used both alcohol and THC in the last year, said that they either driven while intoxicated or been in a car with an intoxicated driver, I believe it was, and then it was up over 50%, I think, for a Delta-8 product. And I guess I just wanted to ask your opinion on that number. To me, I was surprised at how high those numbers were, and I guess just from your perspective, did you have a similar response, and what does that sort of result from a study say to you about what
Yeah.
we need to do?
Just as a caveat on that study, it was a convenience sample of just young adults, but still, it seemed to be pretty high relative. The Delta-8 THC being the among those who used alcohol, regular Delta-9 cannabis, and Delta-8 THC. The fact that Delta-8 THC was the most common substance they used, before, or being under the influence of while driving was interesting, but in some ways expected. We'd done another study where we did a content analysis of YouTube videos about what people were saying about Delta-8 THC. And it's very much marketed as like a diet weed, a work weed, THC light. One person was quoted as saying that, Delta-8 THC brought in a whole new wave of stoners that Delta-9 THC or regular marijuana was just too intense for. So, some people might think of it as, oh, it's probably not at, in terms of a harm reduction, like, oh, if Delta-8, is marketed as, less potent than regular Delta-9 THC, that seems like a safer thing. But if people are using it before driving or at work or in settings where they wouldn't normally be getting high because they think they can handle it, it definitely introduces, additional risk. And so, a lot of these, most of them are marketed as being more potent versions, but even the ones that are marketed as less potent can be problematic for a variety of reasons as well, including driving under the influence.
Yeah, and I was actually, and I hear you, convenience sample, and this was of young adults. I know just anecdotally though, when I've been in high schools and I've talked to principals and assistant principals, when they look at their own very local, like hyper local data, like their school, that they've noticed that the people tend to be more likely, their students tend to be more likely to drive under the influence of some THC product than alcohol. Sometimes there was one school where it was 4 times as high because they feel like it's just not a problem. Is that something that you've picked up on as well, or do you tend to find it's more of that 1-to-1 where it seems like just if you're going to drive drunk, you're going to drive high as well?
Yeah, there's been a lot of campaigns, over the decades about don't drink and drive, because it's
Yeah.
involved in 1/3 of fatal traffic crashes nationwide, right? There's been a lot of efforts in that regard. Not as much with regard to cannabis because it's, for a long time was federally illegal. Just in recent decades have states continued to legalize it for non-medical use. And so, yeah, we're seeing increased, use while driving as it becomes more available. And the for all substances, we know that what's going to affect population level use among young people is largely the availability of the product, the affordability of it, how low the price is, and how it's advertised, where it's marketed, and who that's targeted to, and who it's reaching. And so
Yeah.
basically, if we can address those three things in our legislation, then we can reduce use. And so, especially among young people. And so, I'm not a prohibitionist. I'm not, tend to advocate for bans on products. This seems especially egregious in that whenever states try to regulate it, the industry figures out a workaround, a chemical solution to that regulation, and back to square one.
Mhm.
It takes years to pass these laws, and then the industry finds a way around it. And so, the primary function that these are serving on the marketplace is really to circumvent laws designed to protect public health and safety. And what our
Mhm.
recently published study in the American Journal of Preventive Medicine shows is that these bans work, but the regulations don't really when it comes to addressing availability of these products.
Right, right. I think I'm with you on that. I think it's important to, one, follow the science, but second, particularly if we're talking about what we are sanctioning and endorsing, is saying this can be sold in our country, much less like in a gas station or just like a smoke shop, as opposed to say like a dispensary. It shouldn't hurt people. It shouldn't be unknown. I mean, I don't think we do this for any other type of designer drug out there, but there's this loophole now. But let me ask you a question though, as we're down to our last few minutes, and I want to make sure we get to these last couple of topics. We've talked a bit about regulation and reform, but one of the barriers I think that stands in the way is when I feel like these companies intentionally muddy the waters around data surrounding their product with their own industry funded studies, and we've seen this with alcohol over the years. We of course saw this with tobacco. We're seeing this now even in these current industries around hemp and THC. And you published a paper about this recently as well, about the tactics that are being used to push back on regulations. What did you learn from that paper, and how can we potentially use it to avoid repeating these same mistakes over and over and over again?
Absolutely, yeah. So with these new industries that sell harmful products, we need to take lessons that we've learned from previous industries. So this study identified a few different strong examples of e-cigarette industry-funded research studies that were flawed by design, and done so in a hidden way, a way that most readers, even researchers, wouldn't understand the flaws in them. But they were critically flawed in ways that had them drawing very misleading conclusions. And this has major implications for public health, especially for these were studies on e-cigarettes, because the Food and Drug Administration Center for Tobacco Products weighs all of this evidence, including those funded by industry, in determining whether e-cigarettes marketing and availability are appropriate for the protection of public health or not. And so it has major implications with regard to the availability. Some of these were, drawing misleading conclusions about e-cigarettes helping people quit smoking and things like that, which they used some really wonky extrapolations, but their models were either statistically flawed, they didn't have ecological validity, or they really were kind of had deceptive designs. They weren't testing, like one of them was examining it was supposedly examining the impact of flavors on youth appeal and concluding that flavors don't at all appeal to young people in e-cigarettes. But really what they were testing was the appeal of e-cigarettes to non-smoking, non-e-cigarette using youth versus adult smokers, just based on how they designed the study. And so I think it's really important to keep this in mind. A lot of people, a very reasonable solution seems to be, just let industry-funded research be published by, the tobacco, alcohol, cannabis industry, and just, take that into consideration, take it with a grain of salt. But
Yeah.
a lot of these studies are deceptive. They have like you said, a direct financial incentive to prove something counter to, reality. The tobacco industry
Yeah.
knew long ago that their products caused cancer, and that's what the whole master settlement agreement was. It was about deceiving
Right.
the public in terms of that risk, and other factors, youth marketing and things like that. But and similar issues with alcohol marketing. We know that there are 25 alcohol brands that represent more than half of alcohol consumed by underage drinkers. And turns out those are the ones that are most heavily, viewed advertisements among underage drinkers too. And so even within the e-cigarette industry, where I saw your episode on the Juul, where they were trying to be present themselves as being for smoking while simultaneously advertising in ways that are very attractive to youth. So there's a direct financial conflict there, and the call to action in that study, which I think is very well warranted, is that for these types of industries, we shouldn't be publishing research funded by them because of this direct conflict, that there's reasons to falsify
Yeah.
data or hide things in the study design intentionally to deceive the public. The other thing I wanted to mention is it's getting harder and harder to um, determine whether or not something is funded by the industry or not, because there are these consulting companies, and there have been whole studies on how they kind of play this
Oh,
shell game of funding other agencies that fund other agencies that then fund research. And so it can be tricky even to tell whether, a certain consulting company is receiving funding from the industry or not, just based on how they're moving funds around.
yeah, and even just like that sort of behavior, like that just smacks of deceit and manipulation, right? Like no one does that by accident. That always happens on purpose. And I think, to me, it just really comes back to in this period where you can have a study like that where kids don't like flavors, and even though like that's not clearly not true with anyone who's talked to high schoolers. That can echo around on the internet and studies. Every people can cite it. I think that was where that whole like 1% of people get addicted to OxyContin came from. There was like one study that found that with a sample of like 12 people or something like that, and then that was paraded around by Purdue Pharma
Yeah, and
for
a great example of that too is how many people have heard of the heart health benefits of moderate alcohol consumption, right? Or a glass of wine
right.
or whatever, where numerous studies since then with stronger designs have disproven that, have shown no protective heart health effect, and that even moderate amounts of alcohol consumption increase cancer risk. And so, but those aren't as widely publicized as the alcohol is good for you headlines, which has been widely discredited.
Right. It takes root. Well, I'd like to pivot us back. I know we've jumped around a little bit here. We were in vaping for a second there. We've talked about driving, traditional cannabis, marijuana, THC. I want to bring us back to the derived intoxicating cannabis products, which have now said fluently, and hopefully will continue to do so moving forward. And about meeting folks where they're at, which might be that there's some people who want to use them, or we know that there's a lot of young people who are using them, and they either might have a chemical addiction, there might be some reason why they're making a lifestyle choice where they want to continue. And as I was referencing earlier, a lot of these products aren't well labeled. Many of them have contaminants. There's no health and safety regulations around this at all. So if we were talking with a young person, or anybody really, who was either purchasing or going to continue to purchase these products, is there any way to actually purchase them safely? And where can they go to get reliable information about it? Or is it really just you don't know and it's taking a risk?
Yeah, that's a great question. So there's not really great information. You'll get, oftentimes the advice of like, just try a little bit and see what happens, or don't buy it from this type of stores, but no real hard science to be able to tell, what's going to be riskier or less risky. What's needed is to put a stop to this. It's nothing that we're going to say to them individually. We know that availability is one of the biggest determinants of use. And we know that it works, right? We've seen state laws work. And so what really needs to happen is for this
Mm-hmm.
Mary Miller Amendment to get included in the federal farm bill. And then for states to figure out how to enforce it in individual states. It's going to come down to compliance and enforcement against the retailers. It needs to be, large financial penalties to disincentivize companies from selling this, so that's not just a cost of doing business. And at the local level, what folks can be doing is assessing this issue locally, getting that local data on what's happening, what products are being sold, the impact that it's having on their young populations, and really anyone in general, the negative health effects of it. Um,
Yeah.
and being able to tell those stories to your local and state lawmakers, and localities can even pass bans of these products, even if a state decides not to.
Yeah. Well, I agree with your approach, right? It can be both bottom up and top down, where we try to change the policies in the meantime. And I know this is where a lot of my passion is. I try to talk with the kids, or I try to talk with the parents and just let them know that idea that right now it is a roll of the dice. You don't know. Or here's what we do know, and it's actually pretty sketchy. And you get to make the call. I can't tell you what to do and not to do, but I can try to give you information so that you can decide if this is something that you actually want to expose your body to.
Yeah, it's hard for this because, you know, we know a lot of the negative health effects, right? It's a lot of stuff that's similar to
Yeah.
regular cannabis use, but a lot of it, I mean, we won't know for decades all of the health effects. It's just um, even some of the short term health effects, right? Just based on how hard it is to study currently.
Yeah. Wow. Well, this has been absolutely fascinating today. I just want to take a second and say thank you again for your amazing work, the work you're continuing to do. It's such an asset to those of us who really want to be able to go out and make statements based on more than anecdote about what's going on in the ecosystem, in the market, the dangers that we have to be aware of, why people shouldn't be regulating themselves. Not that anybody should, but particularly not these folks. They've kind of they've seeded that even the pretense that they could possibly do that based on their past actions, and you're documenting them and you're cataloging them and you're publishing in peer-reviewed journals, which is so important. So are there any last words you'd like to leave our readers today in terms of just ways to understand this paradigm, how they can interact with it?
Yeah, so we have a resource at the University of North Texas Health Science Center website. It's a fact sheet on derived psychoactive cannabis products. So definitely check that out. And there's some related citations and links to get more information about these products.
Oh, that would be fantastic. We will put that in the show notes as well. Well, thank you, Dr. Matt Rossheim. Thank you again. I cannot thank you enough for coming on the show.
Awesome.